Hello everyone, I'm Dr. Prachi Kulkarni, Fertility Specialist, 49 Fertility Center, Banjara Hills. Today I will talk about how to decide single versus double embryo transfer. As a fertility specialist, we look into multiple factors like patient's age, the chances of success of IVF, the risk that patient may have if she conceives with twin pregnancy. So, in general, younger patients, we can plan single embryo transfer if the embryo quality is good. In older patients who are going with their own eggs, like above 35 years and doing IVF with their own eggs, then we may suggest going for double embryo transfer. If the embryo quality or grading of the embryo is not very good or it is below average, then also we may ask the patient to consider double embryo transfer. In general, when we transfer single embryo, the chances of success of pregnancy is around 50%. So when we put two embryos, the chances may increase to 60%. But with this 10% increased chance of success, there is also relatively higher risk of twin pregnancy with associated complications. So these complications in twin pregnancy are gestational diabetes, hypertension in pregnancy, and also risk of antepartum hemorrhage or bleeding during pregnancy, early delivery, miscarriages. So in general, twin pregnancy is having higher risk for the mother and baby. So in IVF, I make every attempt to make sure the patient and baby both are safe. So for that reason, it is important to understand what is best for a particular patient. So particular patient, we look into multiple factors like uterine factors. In uterine factors, there can be some fibroids in the uterus or uterine anomalies like unicornuate uterus, bicornuate uterus, septate uterus. Such patients require single embryo transfer because of the uterine anomalies. They are already predisposed for preterm delivery or miscarriage. By twin pregnancy, we do not want to increase their risk. So, patients with uterine anomalies or fibroid uterus, we prefer doing single embryo transfer. Then, for mother's health risk, like if the mother is already having some health issues like diabetes mellitus or hypertension, then those women, they are higher risk with pregnancy induced hypertension and increased levels of blood sugar during pregnancy with associated complications. So, for the women who already have diabetes and hypertension or even cardiac disease or any other severe health issues, we consider doing single embryo transfer for mother's health benefit. Also, patients who have scars on the uterus, like previous cesarean delivery or previous myomectomy or hysterotomy, where there is a scar on the uterus, such patients, to reduce their risk of scar dehiscence, means scar giving away during pregnancy, we prefer single embryo transfer. But it is not just the uterus, we need to see the grading or the quality of embryo also. So, about the embryo quality and embryo grading, if we are having good grade like 4AA, 4AB embryos, then the chances of success are higher compared to CC grade embryo. So, if I am having AA or AB grade embryo and a good uterus with good triple length pattern of endometrium between 8 to 12 mm, then we can consider single embryo transfer. If the uterus is having issues and the embryo grade is not good, then we may consider going for double embryo transfer. Other than this, there is also something called as PGT. PGTA is for pre-implantation genetic testing for aneuploidy, which will give me a genetically normal embryo. If it is PGTA tested euploid embryo, the chances of success are higher compared to non-tested embryos. So if I am transferring a euploid embryo, then I prefer going for single embryo transfer to reduce the risk of twin pregnancy. Because a euploid embryo, there are higher chances of implantation, and if both euploid embryos are transferred and both get implanted, the risk of twin pregnancy, which I already explained, like diabetes, hypertension, miscarriage, and preterm delivery, are unavoidable. So, in that case, it's better to consider single embryo transfer of euploid embryos. So, this is about single versus double embryo transfer. Now, which patients we consider putting two embryos? Patients who are above 35 years of age who are going for IVF with their own eggs, and it is not PGTA tested, such patients we may consider going for 2 embryo transfer. Sometimes if patients has multiple failed IVFs, in those patients also we can put back 2 embryos, but in such patients with multiple transfer, we prefer again single embryo transfer by doing PGTA and putting euploid embryo. So single euploid embryo transfer has the best chance of success, and also it is the safest for the mother and the baby. We consider single embryo transfer in patients who have history of previous preterm deliveries or history of previous rupture of membranes in early pregnancy or previous mid-trimester miscarriages. So these patients are at higher risk of miscarriage, and we don't want them to conceive with twin pregnancy. Also, somebody with incompetent cervix or short cervix, we can consider going for single embryo transfer for continuation of pregnancy and for safety of mother and baby. So this was about the number of embryos transferred. Thank you.